Welcome back to A Slice of Health, where health comes alive, with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. But before we jump into our topic for today, I want to tell you a story. Mel is a 19-year-old. She's been having fights and rows with her mother for the past few months. Her mother, who is a healthcare assistant at the local hospital, has told Mel that her use of headphones is rather concerning. Mel's mother is worried that Mel might be exposing herself to hearing loss. Mel, on the other hand, feels that her mother has become too anxious because of the reading and the work that she does in healthcare. Mel has told her mother to stop reading online blogs and has told her that someone cannot become deaf because of headphones. Mel uses her headphones most days. She wears it on her way to college, on her way back. She uses it on the underground. That can sometimes be noisy. She has her headphones on when she's at home, eating, washing the dishes, or doing her homework. Mel also uses her headphones when she's watching videos on YouTube or listening to podcasts. The only time she doesn't really have her headphones on is when she's asleep. And often that's because her mother has taken her headphones off her head because she's fallen asleep with them. Mel's mother feels that Mel might be using the headphones for a bit too long, and also that she has the volume high and she's worried that this might cause hearing loss. Mel has had no symptoms of hearing loss. The only symptom that her mother claims is a symptom is that Mel can sometimes not hear her when she's calling. Mel has said this is because she has noise-cancelling headphones and she turns the volume way up. Mel wants to know, is her mother being paranoid? Or is this something that she should truly pay attention to? Mel isn't sure how exactly she could live without her headphones. They're really a source of comfort for her. And when she has her headphones on her head, she feels like she's in her own little world and everything is just all right. So today, we will answer Mel's question. What exactly is hearing loss? And is Mel's mother correct about the headphones? I want to share an alarming statistic with you. The World Health Organization recently shared that about 1.1 billion people are at risk of life-altering, life-changing, debilitating hearing loss as a result of their exposure to noise. Now, this statement basically answers Mel's question, doesn't it? It's basically saying that 1 billion people who are young can have hearing loss simply because of how often they are exposed to loud noises. Now, wearing headphones on their own are not particularly a problem. However, the volume of the noise, the volume of the audio, and the prolonged and sustained exposure to those volumes can contribute to hearing loss. What exactly is hearing loss? Hearing loss is basically what happens when something has an impact on your ability to hear. There are different kinds of hearing loss, and 1 in about 3 adults have some sort of age-related hearing change. And increasingly, we start to see that actually about 2 in 1,000 babies are born with some sort of hearing loss. So these are the two extremes, people that are born with hearing problems and people that develop hearing problems as they get older. There's other kinds of hearing loss as well. So we have the hearing loss that is affected by damages that have happened to the nerves. And then there's hearing loss that can happen as a result of damages that happen as sound tries to pass through the outer ear from outside into the inner ear or the middle ear. That kind of hearing loss is called conductive, and the hearing loss that affects the nerves and the inner ear is called sensory neural. Yes, I know, it's a big word. And then in some situations, there's mixed hearing loss as well. Now, hearing loss has lots of different symptoms. Sometimes people find that they need to ask people to repeat themselves. You might find that you're finding it difficult to follow a conversation or think that people are mumbling. In certain situations, it might be loss of hearing certain kinds of pitches of sounds, like birds singing, or even certain tones when human beings are singing as well. There's also the need to increase the volume on the television compared to other people who feel that the sound is fine. Tinnitus can sometimes be a symptom of hearing loss, and that is sort of that ringing sensation in your ear. Sometimes hearing loss can come with earache, and in some situations, there can also be changes in your ability to walk properly or balance yourself, or in some situations, dizziness. There are lots of different causes of hearing loss. Sometimes hearing loss can be as a result of damage to the eardrum. You could have a tumor or a mass in the ear. Sometimes if you have an infection, that can cause hearing loss. Sometimes also if you have a cold or an allergy, that can also cause hearing loss because the tube that connects the nose, the ear, and the throat can sometimes become filled with fluid. And if that fluid gets stuck in the middle ear, it can also cause temporary hearing loss. Something that also causes hearing loss is earwax. Earwax can build up in your ear and cause hearing loss. But for other kinds of hearing loss, what exactly is noise-induced hearing loss? Noise-induced hearing loss is exactly what it says on the can. Hearing loss that comes as a result of loud noise. Now, let's talk a little bit about loud noise. Noise is measured in something called decibels. So, the sound of breathing normally is about 10 decibels. A washing machine is about 70 decibels. A lawnmower is about 80 decibels. A gunshot is about 140 decibels. Can you guess how much exposure to loud noise the WHO classifies as being bad? 85 decibels for 8 hours. That means that sound of just about a lawnmower for 8 hours is already a critical point. Do you know how loud your mobile phone gets when you're listening to it on maximum sound? It's about 100 to 110. So if you have your headphones on, your AirPods in, and your phone is on maximum volume, you've already exposed yourself to high noises. And noises above 85 decibels can damage your hearing over time. This is extremely important because there are complications that are associated with hearing loss, such as your ability to speak as well. Hearing loss can definitely be diagnosed by lots of different tests that can be done in a lot of clinics, or you can speak with your healthcare provider who can also arrange a referral for you as well. But oftentimes, hearing tests can be services that you can walk in or book an appointment with an audiologist to have a check on. The most important thing here is that increasing volume and perpetually exposing yourself to these volumes over time does cause damage. So the headphones on themselves are not the damage causer, but increasing and exposing yourself to these loud volumes perpetually over time significantly increases your risk, especially for people under the age of 35. The challenge is that once this damage happens, it's not really reversible. And if it continues, it can lead to permanent hearing loss. So, what steps should we suggest Mel start to take, seeing as today we've agreed with her mother that having her headphones on on max volume for most of the day, except when she's sleeping and in class, is a challenge. The first thing we'd say is turn the volume right down. Listening to your music on your headphones at maximum volume is just not a good idea. The second thing we would say is when she's in loud environments, to encourage people to actually reduce the volume of sounds, of music, to take breaks actually, and even use earplugs if she's going to an environment where there is going to be a lot of loud volume. Over the ear headphones are actually a lot better than inner earbuds. They're gentler on the ears, and the sound is not as direct towards the ear. One of the most important things that we should really think about as well when we're talking about this is also to encourage herself to have time away from her headphones, to practice other hobbies that don't require her having headphones or plugging her ears. Really important to be aware if she notices any changes in her hearing or if she's developing any ear ringing or tinnitus. Now that her mother has noticed that Mel seems not to hear properly, I think it would be worthwhile for her to speak to an audiologist as well, to really have a look and see what is going on. Now, harmful noise at really high levels have also been linked to things like anxiety, stress, high blood pressure, and poor sleep. And so it's extremely important that such things are paid close attention to. So for today, we will tell Mel that her mother is correct. Prolonged exposure to loud noise from headphones does increase her risk of hearing loss. And as we opened with the statement that the WHO is concerned that over 1 billion young people are at risk of life-changing hearing loss due to loud noise exposure, and overuse of headphones at loud volumes also increases the risk. So that's it for me from today. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.